It's a good one. So we are going to ask our senior client manager, Beste Kuru, who was part of this event at least a couple times, and she's one of our leadership members in United Medical. Hey, Beste, how are you doing?
Hi, Kemal. I'm good. Thanks for having me.
Thank you for being with us. So we want to talk about one of our services that we do, obviously, is the RCM and the medical billing, commonly known. So if you can explain to us part of your day-to-day issues that you are dealing with and how you are actually working with those issues, what United Medical does. So,
of course. Hi, everyone. So as part of the RCM team, what we do is actually acting as a bridge between medical practices and payers. And we try to correct the mistakes maybe that happened on the practice end or address the payer stemming issues. And today we just wanted to talk about the most frequent denial from payers and the major problem that is causing delayed payments, no payments for practices. So Kemal, I did want to share this. This was an article you published actually back in June 2020 on LinkedIn, Mastering Revenue Cycle Management. And there, I quote this from there: insurance-related issues make up about 40% of all claim denials. And this is still valid and supported by our own data. The next slide, I am just giving a summary of only the last 12 months of our corrections on the client accounts. Out of the about over 106K corrections we made only on the preventable side, about 20% come from incorrect or missing insurance information for patients. And that is just one part of the eligibility issues, right? So we are looking at a picture where eligibility related denials are making up a majority of the problem on the preventable end. Other examples of top denials that make up the eligibility issue is maybe providing incorrect ID, relationship, or date of birth, or just entering those incorrectly into the PM system at the practice end. And again, this is almost similar, like very much similar, but we are just identifying these in more detail whenever there's no insurance coverage for the patient. So maybe eligibility was not verified at the office. And again, when a patient is a Medicare patient, there are cases where the patient has Medicare HMO rather than the traditional Medicare.
So these are our D codes, correction or denial codes, right?
Correct.
So these four, you are saying that they're all about patients do have insurances, but we don't have the right one. They do have some coverage, but we don't have the right one in place.
Correct.
Right. So now, what's the root of the problem? Like, where do we get that incorrect information?
So mostly it comes down to not verifying through the correct channels in a timely manner before the visit. So what often happens is patient maybe comes to the office with an old insurance card. Their maybe eligibility was not verified prior to the visit date. So the front desk just accepts the card as is, doesn't even verify the information on it. And then just the visit happens with the provider. And later, once the charges are entered, what happens is we are like the system, the practice is basically trying to send the bill to the incorrect insurance, which will not even be able to maybe identify the patient, or will say that, no, we don't have coverage for this patient anymore. It was, 3 months ago that the coverage ended.
So, the interesting part, Best with this is, there's no other business in like at least what we know, there's no other business where you don't actually get paid day after you provided the service. And you go to doctor's office, patients think that they're paid already, and then they're not. So how long does it take to get paid? If there's no problem with the claim, what's the average payments lag?
I would say of course, there's standards too, but it will differ per specialty maybe and where the patient is seen, whether be it in office or hospital setting. Ideally, and this translates as a days in AR KPI in metrics. Ideally, we would say under 20 days. If the account is clean, the system is running smoothly, everybody is doing what they're supposed to do in a timely manner, we see from 15 to 18 days, but for problem accounts, that's usually not the case, right? It climbs up to 40s per MGMA. Maybe the upper limit is accepted as 40, but we do also have cases where it is far above 40 days, where it takes about on average to pay the claim. Well, it is preventable, and it is actually sounds like it is easy, but somehow the flow management on the practice end is not very easy to do. I understand, but we just want to highlight here the importance of verifying eligibility correctly upfront, and I will also list some suggestions for the practice end. Well, if we are able to verify eligibility correctly upfront and in a timely fashion, it will translate as increased claim rate, right, and increase in cash flow for the practice. And we are hoping to see improved rates on denials, which means less denials from the payer and more direct payments and less eligibility PCP or coordination of benefit issues. And again, it comes down to how many days it takes to get the claim paid, which will mean improved days in AR and faster payment. And what I suggest, and we suggest as a team here, consistently to our clients, is to create and follow a routine workflow using always digital means to our advantage, verifying eligibility, taking SNPs, proofs that what is valid between which dates and what is covered. And we want to also verify eligibility, PCP, COB type of information prior to the visit, and definitely confirm if you are able to on the date of visit to make sure there isn't any change. And it is also very important to get your patients to take action prior to the visit. For example, if there's an older balance, if they had to contact the payer to update their PCP, COB, we need to engage the patient and make sure that they take action. They call the insurance and they make these necessary actions to help get the claim paid. It's also important that we train personnel and make sure that they understand how their role directly impacts the revenues for the practice. And again, using digital platforms like insurance portals, Navinet, Availity to verify this information.
So now our practice management PM system, it does actually now check all the eligibilities ahead of time. The issue is system checks those, but then what you do with the data, right? So that's kind of like the problem these days, where we have so much data, but we don't have, if we don't act on it, then you cannot use it. So it's not going to be helpful. So now what we are trying to say here is there is a preventable issue that's happening, that's impacting our payments. And this comes from our practices to our business office, back to the insurances. And there's always this perhaps issue of accountability. So now we wanted to discuss the service that we are providing, but also when we find out what's not happening, how do we keep people accountable? or practice is accountable, or the business is accountable, or the insurance company accountable. So preventable, just the way that the word, it means something that can we can actually stop happening. So we can check the eligibility before patient gets there. We can get the co-pays at the time of the service. We can do so many different things. And if they do everything perfectly, they may not need a billing company. That's and then I don't mind that because we own practices, right? So, but the thing is, we should be more accountable. So this part you are not actually. You probably didn't see what was coming from here. So you did your RCM update, and thank you for being part of this. But I do want you to stay if you have time. So because the thing we have from here is since Sean started, and Sean can come up as well. So we wanted to add a couple new things to what we are doing. So you discussed this preventable issue and what we are doing, how we are actually dealing with. So one of my retreats that we used to do when we were able to do things in person for United Medical Leadership, it was the leadership retreat, and I'm hoping that we can go back to those events one day. So one of the book assignments that we have was crucial accountability. So which is kind of in some cases it's being confused with crucial conversation, but this is actually crucial accountability, which does include the conversation piece. So this, from the business side, this book is extremely strong, right to the point, and it's one of the books that I actually recommend our management teams. I know most of them should have this, either the print or the audio. And I think it can be used for what's the issue that you are describing. And just to kind of see what was, like, this is, like, we talk about here, like, violated expectations, broken commitments, and bad behavior. Now, we are not talking about, like, the emotional relationship. We are talking about business. So this is a business book, although it can be used for the other stuff as well. But if we are discussing here is something preventable did happen, then someone has to be accountable, right? So the part that the issue that I'm always having a difficulty with, if they're not accountable, and if we are not making them accountable, then how are we going to actually move on and fix it? So we don't want these issues to happen. So we want our medical offices, check in, check out, back office. Everyone should be taking their job seriously. And also same thing for our offices, the account receivable representatives that we have, our managers, our leadership. So we can't take these for granted. So we have to be accountable for what we do. Now, anyone who is interested in this book, I don't get any commission from it, but I can buy it for you if you don't have it yet. So it does actually come with some tools that can actually that can be used for different exercises, and I definitely do want this to be utilized by our management team to identify these issues. Now, Vesa, were you at those events? Like, did you make any of the?
I was not part of the retreats at the time.
The last one we did was 2017 or 18.
I mean, we had a bunch afterwards, and yes, I was part of the 2017-18 ones, but not the earlier ones, I guess, when you went more in depth into maybe discussions of similar books in management.
Maybe. Now I know Sean is going to read this by next week, right? And
in there right now.
There will be a brand new Sean coming back.
Right.
All right, so that's kind of what we wanted to have from the RCM side, and then kind of just tying that into our the book advice and not a review necessarily, but more like an advice. So if people are bored and then they want to actually learn a little bit more stuff on the technical side of it, it's a pretty strong book to address some of those accountability issues and helping us to have some of those uncomfortable conversations, because many of us are not really confronting the issues in a proper way. And we do need some education, some knowledge to address those, and it's a really great book. Now, I know, Best, if you've been with our leadership team for a long time, and I always admire your approach on the problem solving and addressing the issues, and you are doing a great job. And I know that clients are happier, and we want to make sure that we can actually take that and then make it part of our medical culture, so that we are always accountable with what we do. Just one little thing, it may not be fully related to what this is, but yesterday when we were getting ready for the event, and we did let you know a little bit late, and then I was way too late to let you know, but I didn't realize that Sean actually did communicate with you way earlier than I did, and I didn't tell him to do that. Right. So, but what it means is that stay accountable. So he's part of this. And I was busy with several different meetings. And when you were leaving last night, when I was trying to tell you nicely, I'm like, she's going to be like, not happy. I'm like, and then you said, well, you already sent the slides and you already knew what it is. And I was happy that you did what you did, but also I was happy that Sean picked up that issue and then did complete that piece and made it seamless, and then everyone was ready. So that's part of the team, and I'm part of the accountability, and I really do appreciate that. So, well, thank you for joining us today.
Thank you, Kemal.